The following is a video about acamprosate, a medication used as a treatment for alcohol dependence. It was developed in France in 1982, but it was approved in the US in July 2004. The mechanism of action of acamprosate is not completely understood. However, evidence indicates that acamprosate interacts with the glutamate neurotransmitter system of the brain. The brain uses neurotransmitters to send messages in the synapses. Some of those neurotransmitters are excitatory, some of those neurotransmitters are inhibitory. Under the excitatory category, we have glutamate. Under the inhibitory category, we have GABA. And the brain likes to keep a balance between these two systems. Chronic alcohol consumption promotes a pathologic excess in the glutamatergic neurotransmitters. Okay? Mr. Jones has a drinking problem. He continues to drink many times, and over the years his brain develops some changes in which the glutamate system is pathologically hyperactive. Okay? One of the theories regarding acamprosate mechanism of action is that it reverses this glutamatergic hyperactivity state. Whenever Mr. Jones is on a glutamate excess, the patients are described to have something called POS. POS means post-acute withdrawal syndrome. It basically means a lot of glutamate. A lot of glutamate will create problems such as restlessness. Also will create some mood problems such as anxiety, depression. It will create some problems such as insomnia, etc. So POS is an umbrella term for all of these symptoms. Literature suggests that POS, all of these symptoms, somehow stimulate the patient to continue in this cycle of drinking. Acamprosate, by interacting or stopping this excess glutamate activity, seems to remove POS from the picture in an oversimplified fashion and free the patient from this cycle of continuing drinking. I would like to mention two other important points. Let's pretend that this is the liver. Patients with chronic alcoholic problems, they start to damage their livers. One of the advantages of using acamprosate is that acamprosate is a medication that is safe for use in patients with liver problems. That is because it is renally excreted. That also brings to mind that we have to be careful in patients that have problems in their kidney function, because the fact that acamprosate is renally excreted. Another important point to mention is that patients taking acamprosate do not develop tolerance or withdrawal or addiction to acamprosate, meaning it's a safe drug in that sense, and is a very safe drug. The side effects include diarrhea, some abdominal cramps, some muscle weakness, and insomnia, anxiety, but they are uncommon. And it's important to mention too that alcohol addiction is a very serious problem. that has several implications, not only in the health of the individual, but in the family of the individual, economy, and his job, his social network, and a lot of problems. So using a medication such as acamprosate could be a worthwhile agent to try to stop the alcohol addiction problem in the patient.